So again, the big headline this week on healthcare is that the White House announced it surpassed its goal of signing 7 million people up for Obamacare as we got into April here. And who would have thought that just a month or two ago? And there were a lot of people who pounded the pavement to hit the ground to try and get to that number. And one of them, Daniel Liss, a Harvard University grad, former Deutsche Bank employee who decided he was going to ditch it all and head to Alabama, of all places, to try and make a difference. Now, I spoke with him earlier today about his push for quote-unquote Bama covered. Deep thoughts, deep thoughts. We're going to see if we can get the audio straightened out here, and I'll give a little primer on what we kind of covered, which was, and people may have seen this piece in the Times, which really was what prompted that conversation. He and another guy were watching from afar, and they saw how Obamacare really couldn't get off the ground. And it was a self-indictment, the disastrous rollout of the website and everything else. But they knew instinctively, one from personal experience and the other one, that healthcare, the current system could not be sustained. There had to be a better way. So what they set out to do is they went down the ground and with nothing but volunteer college kids, went literally first in the college dorms to the people who were cleaning the places, who were making the meals for the kids, and they said, let's tell you what's out there. And by the end, they had 600 volunteers with almost no money of any funding of any kind here. And they were able to sign up thousands of people here. And it was interesting. I didn't realize this, but the cutoff, for example, in Alabama, you make $3,000 and you have a family of 4. You're cut off or you're not eligible for Medicaid. I mean, just think about that. And then the consequences we know, and you could explain better than I, is you go to the ER door, basically that's it. There's no more room at the inn at the hospital for you. You can't get it. And some of the triage decisions families have to make about what they can and can't get for care is amazing.
Absolutely. And Alabama is a great example of a place where they decided as part of Obamacare to reject the Medicaid expansion. So millions of more people in Alabama could have access to Medicaid and could have access through the health insurance exchange, but they've rejected all those federal dollars and they've rejected that opportunity to make that safety net even bigger. So in states like Alabama, there's nowhere for these people to go. They can go to the emergency room, and if it's in fact an emergency, they'll get care. But for chronic diseases or any kind of routine care, there's nowhere for them to go. And that's how we see the tremendous amount of healthcare costs and healthcare problems that we have in this country, because so many people simply just don't have access to the healthcare system.
And if you could explain for a second, literally state by state, there's different rules what Joe Smith or Mary Jones can get for coverage, right? I don't think people appreciate that, because if we're in New York or in Connecticut, my gosh, I mean, literally, you got nothing in certain places in this country if you make any money. Not a lot of money, just any money. Am I right?
That's right. And the way our government is set up is we delegate certain powers to the states, and one of those is health care. And so how we set up the benefit system in Alabama and the eligibility requirements for getting something like Medicaid is radically different than the standards in Connecticut or New York.
And if I could, we have the interview queued up now. I'd like to bring us back again. This is Daniel Liss, and again with a program here, and you'll hear it yourself, where he started along with a partner here in Alabama, all without any profit motive in mind, but just to get people signed up for health care. Again, our conversation. Talk about the conversation that led you to say, sure, I'm going to pick up the phone, tell my parents basically that everything that I've achieved at this point I'm going to put on hold and go to Alabama to try and get people to sign up for health care. How did that conversation go?
It went well, actually, surprisingly. My best friend in England is this guy, Josh Carpenter, who's a Rhodes Scholar, went to UAB, University of Alabama, Birmingham. He's from Florence in the northwest part of the state.
Yep.
And October comes around, and like any American, we're reading these headlines saying to ourselves, man, this is a disaster.
Yes.
And no matter what you believe politically, October, November, it was a disaster. And that wasn't particularly insightful of us. But what we said to each other was, well, what could we do? You know, we're 25. We're not that far out of college. And we thought, well, what's missing from this effort is that the emphasis is in the wrong place. It shouldn't be on what the politicians are saying. It should be on getting health care for your family. Because to have a system that works, to actually access hospitals for families to stay together, people need to be able to go to the doctor. And that has nothing to do with politics in Washington or any state capital.
You decided to make this apolitical because Bama's a red state here. But one thing the state, I guess, has a proud history of is citizen, not only involvement, but volunteerism, especially given the strong religious roots of so many people in the state. And you drew upon that, right? When you went around and said to people, listen, we can make better lots here for your fellow citizens if they have health coverage.
Exactly. So that was not anything new. And for me, it was actually my first time in the great state of Alabama. It is the most amazing place on earth because the sense of community is so palpable, and you can engage in a conversation. And ultimately, when we think about what did we train 600 college students to do, it was to engage in conversations about healthcare.
And that's the army that you have with you.
It takes about 10 seconds looking at the health statistics in Alabama to realize that the state needs a lot of help, right? It is bottom 5 across the board. Diabetes, cholesterol, obesity, infant mortality, you name it.
Explain to the public some of the most commonly asked, not just questions, but misconceptions you'd run into about the law. And then the good and the bad. I mean, some of the legitimate concerns that after they go through the process that they're still left with, but also some of the revelations that people say, my gosh, now I can go to the doctor. If you could, try and put a human face on what you found on the ground level.
The biggest question we get over and over and over again is what am I signing up for?
People don't know what it is,
people
right?
don't know what this law has created, right? It has shaped the landscape of American healthcare in a new way. And we always say, listen, well, in Alabama, different from New York and in the tri-state area, there is not a lot of choice. There's a near monopoly. There's one company, Blue Cross Blue Shield, that controls 90% of the market. It's the only choice in 64 of the 67 counties.
Yep.
So we say, we are talking about Blue Cross, Blue Shield, private insurance, top of the line, potentially at a discount. And that's the other misconception, is that it's not affordable for me and my family. Well, depending on your income, you could be getting a $20, $50, $100 a month plan with lower costs, right? The best plan I've signed someone up for over a dozen times, $0, $100 deductible, and $500 out-of-pocket max.
Really? Is the sell harder than the perseverance they have to do from start to finish to complete the thing? I'm curious.
When the website was having difficulties, obviously it's different. New York has its own exchange, which has been working flawlessly from the start. But in Alabama, we were dealing with the federal exchange, and clearly there were issues. So when the website was working slowly, or you couldn't get the email, or couldn't verify identity, then clearly it took a lot of will. But if there's something that students really have and young people have, is we've got the energy, right? So we've been able to work with people and say, listen, this may take an hour of your time, but health insurance is worth more than an hour of your time with the cost of medical care, what it is in this country. And people have been willing to listen because we say, listen, this isn't about the politics of it. This is what's on the table for you. Have you gotten your preventative care checkup this year, which will be free with your new insurance? Can you get the prescription drugs that you need? Can you go to the top specialists for whatever problem you have? And I think people can connect with that time and time again. And I mean, so many amazing word of mouth stories where we sign up the chef of a bar, and he subsequently, the next day there's an event and the entire staff is there because he got it for $30 and they all make kind of something similar, and they couldn't believe. And it's too expensive for the employer to offer something. So you have the owner encouraging his employees, saying, "Listen, I care about you. I want you to be healthy. I can't provide you, I can't provide this coverage for you, but go check it out."
If I multiplied your volunteer staff 1,000-fold, and you could do this coast to coast, do you believe the numbers that we're looking at now would also be multiplied?
Yes, I definitely believe that, because for us, you know, when you ask
Because they
me,
haven't marketed it the right way, right? I mean, I thought when you said the first question I get asked, I thought they were going to say, how much is it going to cost me? But it's what is it? People still don't know what's in this thing. And shame on the administration for sales, marketing, whatever you want to call it. But still, that void, people will be able to fill misinformation into what it actually is, so people don't know what they're signing up for. They just know there's a deadline, right?
I think it's going to be iterative, right? If you look at, you know, what was amazing for me is sitting down with so many families who survive on so little.
Yeah.
I mean, some making literally nothing, but others have their Social Security payments, their disability payments, their SSI, their veterans pensions, right? And those programs came into force in some time in our nation's history, and it probably wasn't pretty in the first year. And so we think a lot, and I think are inspired. When Social Security was rolled out in the New Deal, I'm sure that there were kinks.
Oh, and we went through the history not long ago. Medicare, the same thing as well. Dan, I'm curious. We sit down a year from now, 5 years from now. Do you think those people that you guys have canvassed and convinced and signed up are going to have buyer's remorse, or are they going to say this was one of the smartest things I ever did?
I mean, to step back a second, when we say what is Bama Covered about, it's about educating people about healthcare options. And if enrollment is the right choice for you, then go for it. We can help you do that.
Yep.
There is not a doubt in my mind that the people who have gained access to healthcare will count it among the best decisions of their lives, because we have worked with people whom we met in December, and subsequently one person I signed up had a stroke in January and was covered. And you know, that's two things. That's A, containing cost, right? That could have meant bankruptcy for that man. And he has children, and he provides for a grandchild as well. But not just that, I mean, it's people who go to the doctor when they feel sick instead of trying to sleep it off.
Yeah.
Because he was not going to sleep off that stroke. So for him, without a doubt, it was a life-changing decision in a literal sense.
Well, hey, we always like to think you can impact or like to try and impact lives. It's amazing, not just yourself and the co-founder, but all those volunteers, all those kids. The people always put down the millennials for not thinking about anything but themselves. What they've done down there, that's a testament. Anyway, I really appreciate a few minutes. Thank you so much, and I wish you the best of luck. Doesn't seem like you need too much of it.
We need it. Thank you.
I'm up against the break, Summer Andrew, but it is amazing. You know, we give kids a hard time here, and sometimes deservedly so, but really, to be able to do that, and you see young people all the time, that's something else.
It's wonderful, and he is a great spokesman for what young people can do, and how if young people get out and enroll in health insurance and get others to mobilize to do this, that this program will likely be a success. We don't know what the future of Obamacare is going to be, but with young men like that, I think it's got a bright future. And much needed too. A lot of states reached out to try to get as many people enrolled as they could. A number of other states where it was less popular by their governments actually made it very difficult to try to get people in, fewer centers for them to go, fewer places and resources for them to get information about it. Alabama was one of those states, so groups like that one brought people into the fold who otherwise might never have gotten covered. And they did it all on their own. This wasn't a government operation or anything. They literally took it upon themselves to bring it to the masses, as they say. Summer, thank you very much. Andrew, as well. All right, coming up next here, RFL In Depth, providing context here on a couple major stories we've talked about on the show a lot, including the battle against the heroin epidemic. And we talked to cops in our region. They're being prepped as overdose lifesavers. That's how bad this thing has gotten. Trying to stay ahead here of this drug's rapid spread here. We'll have much more on that right after this.